generalisation, but for men sometimes just being able to see it drawn out, going to sort of rock bottom, would be this excessive use of drugs and alcohol. Or when he felt there was pressure in his relationship with his girlfriend. Or the arguments and disagreements in the family, which he never felt got resolved, just got moved on. And he was left holding that tension quite often as he was maybe the bridge between his parents. So when he failed at work, and that was his perception, I never got the sense he did fail, but for him, he failed if he got something wrong or masculine role at 32 and being single and not being married and not having children. That all had an impact on him. Exercise, and when work was going well, and one sister. He had 3 sisters, but one sister he could talk to a degree. And they were the supports. So for me, my work would look at how I manage triggers, how am I helping him have a language to talk to his sister, helping him have a language to talk to his other 2 sisters, trying to get him to talk to his brother. So just a way of expanding the support and reducing that isolation, and realising that some of his families, his sister and his brother, also had very similar feelings about their history and their family. Reduce some of that isolation. So I've talked about the hierarchy of needs. For me, building a sense of trust and openness is really important when working with someone who's suicidal. For me, is being able to hold those negative feelings and not panic. I can tell you, every time someone tells me they're suicidal, I do panic. My stomach churns. I feel a knot coming up into my throat. I worry about whether I'm going to be good enough to manage this and support the person. But I desperately try not to show it, because actually, if my client can't trust me with that most horrible of knowledge and information, then how are they going to hold it? And it's really about just making sure that they feel safe and that they don't hold back. Because if they, what I find sometimes is my clients sometimes worry about how I'm managing their feelings. And you know, to be perfectly honest, I manage them fine. I have a supervisor, I have a network of friends. You know, today I'm doing fine, and if I'm not doing fine, I don't see clients. But it's really important that they feel that you're not making a judgment and you can manage and hold those feelings. So show concern and not fear. And I think it's really important for me to actually say to someone, I'm worried about you. Not I'm panicking, not you're making me come out in a sweat, but I'm worried about you. And actually sometimes it's one of the rare occasions somebody does actually say it to the person. And that can be really powerful, that simple sense of being concerned, but not panicking. So, I think I've nearly come to the end. Really? That's it. There you go. Okay. What I would say, I would echo Sade's comments. Consistently, it's obvious when you talk to people who are suicidal and very depressed that they're very isolated. They're very isolated in those feelings and in their sense of being in their families and in their world. They're very fearful and they're very ashamed. And so for us, when we're not feeling that way, it's really important to accept those feelings and to hold them and to not panic. Thank you very much.
Thank you. Our next speaker is Dr. Amina Kadira, and she's a consultant neuropsychiatrist from Nigeria.
Thank you very much, and indeed very honored to be here. Lydia is very passionate about what she does, and that is what brought us together. Facebook friends turned to reality. And I practice in Nigeria. I work and live in Nigeria. I'm here for other things. And when she brought up this event, I said, okay, good. Since I'm going to be around, I don't mind sharing the cultural perspective of what is actually happening back home. So this is Nigeria. So let's go back to a picture of where Nigeria. Let's go back to like slide 7. So this is Nigeria. This is a picture of Nigeria, green, white, green, of over 180 million people and counting. Religion-wise, Christian, Muslims, traditionalists, some don't even assume anyone, but predominantly they are more Muslims than the Christians. We have the northern part, we have the southern part. But statistically, what we have on ground is that we have 1 psychiatrist to 1 million Nigerians. So there's a huge gap, there's a big debt. In fact, our current medical students, when they graduate, they don't want to even go for residency because there's so much rancor with residency. Training, mentorship is not so encouraged. So people don't even want to go into that. They just want to go work with one company as in-house physician and move on. And with what WHO is saying regarding mental health, in Nigeria, when we talk about depression, 1 out of every 5 Nigerians is depressed. It's not about will be depressed. This is statistics. Is depressed. So talking about cultural perspective, they have the good and the bad part of it. Let me give you an example. Just last week, I wasn't in London, I was another part of Europe. And a lady with a 3 and a 1-year-old child were in the mall. Apparently they were buying things, and then she started acting out and almost tearing her clothes. And of course, the mall had first aiders. They came around, they called the ambulance, 911 came around. System is effective. And the thing that drew me to her, because there was so much around her, they drove every other shopper away, was when she started speaking one of the Nigerian languages. I said, okay, this is it. This is the only way I could help, because she was cursing herself. Oh, why this, why that? And I couldn't grab everything, but I could understand. So I quickly said something. In every culture, there are normal things you will frequently know, the greetings and of course the bad things. So I quickly greeted her in her language, and then she turned. That was what helped.
Connection.
That connection. So every other person was like, oh God. The first aiders, everybody, they were like, okay, you have to help this woman. I didn't know her from anywhere, but we were able to get everything sorted and escorted her back to the airport, where she went home with her children safe. They've called me, they are safe, the husband, because she was here, a 3-year-old and a 1-year-old. She's already going through depression, and the husband felt the only way she could enjoy herself was go on holiday, but she now went to 2 children. A 1-year and a 3-year-old that demand attention so much. And trust us, I'm a Nigerian. Airports are built for Nigerians and Indians. I hope there's no Indians. Why? The reason is that at the airport we are sorting out clothes, buy one get one free. At the end of the day, you find out all the things you bought, you are dumping it because of excess luggage. So she was worrying so much. This person is calling her, buy this. So yeah, I learned you are here, buy this. And then children are dragging her here, and then she just gave up. So culture saved us at that point in time. This is me, because I have a blog, I do the life of a shrink. Why Indian again? I'm very sorry, but this is an Indian couple. We're going to the US. And all of a sudden, in the middle of the air, this man and the wife got up, went to the overhead, brought out their hand luggages, and started walking towards the pilot cockpit. I'm like, everybody, what are they talking? Maybe they want to go to the restroom. So the waitress interjected and like, sir, can we help you? He said, no. I'm going to meet the pilot. Stop the plane right now. Stop the plane. I'm tired. The journey is too long. The journey is too long. That was their first time. Later we got to know that was their first time of travel. They panicked. And you can imagine when you want to save money, you buy cheap tickets. And then you are moving from like Abu Dhabi to New York. They terminated New York because I was going with Etihad. And like 12 or 13 hours flight. So like, the man freaked out. What saved us again? Culture. An Indian man came, spoke language. If not, they were already going to hold him down, sedate him. They already called doctor because I was sleeping. Emergency, we need a physician. Emergency, I'm like, what's happening? That was when I got to know there was this issue. So culture has a major role it plays in our lives. But on the flip side, it can also affect us in many ways. Yes. From where I'm coming from, culturally, Dr. Olajobi cannot stand up and say, I battle depression. Oh, no. I'm a survivor. Never. Nobody will see her again, no. So go to a clinic. No, forget it. To go to a clinic, a psychiatrist dealing with depression, you're on your own. They will never come. They say, she'll still manage herself. She wants to manage me. And this is what it is. People will walk into my office and like, I want to see Dr. Kadri. I'm like, I'm Dr. Kadri. He said, no, your dad. I'm like, I said, this is Dr. Kadri. And then when they finally sit down, they're like, but you are young. I'm like, yes. But you're a woman. I'm like, yes. Then why are you in this profession? This is for men. I'm like, they are answering. So I now have like a wall of fame where I have pictures. So you don't ask me for my certification anymore. Because when they come, want to see this, that, it's a whole lot. People do not come around. My practice do not have a signboard. I did put it, this is Pinnacle Medical Services, because it's online, people will Google it. And they're like, like they came to go. So our case is that bad. How God, fine girl like that. Oh, my shield. Sorry, that is Yoruba language. They will, so people come quietly, go to Google, text to Google, midnight, and Google, and find out where they can search for help, and call, and then sneak in and sneak out. Yes. So access to care, despite the fact we have that wide gap of 1 psychiatrist to 1 million Nigerians, that access, people don't encourage it. Because the moment I come to you and say, oh, I have this issue, I have this issue, the next thing, the lady or the other person will tell me, say, really, your space is very small, let me just tell you my own. So you are going to leave that venue with your problems you came without problems that thinking that your own is now a small problem, and then it keeps piling up. That's fine. And the problem will never go away. No. So the cultural things we see in this regard is that it's not helping stigma. Stigma is associated to mental health everywhere in the world. We know that, but because of the stigma, the labeling, people do not have access. They do not come out willing to say, this is my problem. This is what I want. This is the help. Because if we want children, I forgot one of the speakers, I think it's psychotherapist who made, yes, example of the young man, John, who, thank you very much, schooled here, went back, oh no, the forest is sending them back. Tokumbo, call them Tokumbo returnees. The forest making people withdraw their children from here back to Nigeria, who are not willing to return now. So you find them struggling with the system, rebelling. Some have gone into substance abuse. Some have threatened. In fact, I met a young girl who actually poured bleaching, whatever, into a whole pot of okra soup, freshly cooked. And then she told me, not without remorse, that, look, everybody dies, she dies, case closed. What saved the day? It was the cook who saw when she was pouring it. Because everybody will have eaten thinking that the okra just has a different taste. Bitter. So they will just eat it. And because it was hot, freshly made, it would have just been so easy for them to just eat and move on. So we're having quite a number of children struggling with depression. For the youth, this is how the range is. If we talk about gender, women more than men. When you talk about depression, which is also known worldwide, emotional issues, marriage is not a protective factor for women. Sorry, we married women. It's not a protective factor. Yeah. Your name, so you have your parents' siblings. Your husband, you are coming in with his own siblings, family, and everybody. The children are going to come, his friends, your job, your friend, everything. It's a whole lot. So it takes the grace. That's why women are, if you go to churches and mosques, you find more women there. We are very prayerful. That is our only saving grace. So when you say they are going to mountain Friday with women, and they will carry their husband's picture, so they will pray. So that the man, things will change for him. Yes, these are the cultural things we see. We have a lot of similarities with the Indians. So it's because coming into psychiatry, I realized we need to know what culture, how they relate and all that. We are the Caucasians, we are different. People will call, I want to speak to my shrink. In fact, my friends can't call me their friends. The moment they have not seen me for a long time, they seem, my friends, no. You are not my friend. No, they don't call me my doctor. They don't, because they just believe that when they call me, you are my doctor, there's something wrong with them. Who are those that are not Yaba Psychiatric Hospital? Those are Nigerians.
I used to work there.
Some people have been in Lagos, a major city in Nigeria. They have never, in fact, when they are descending the bridge, they are looking at the other side of the road. Because they don't want to be associated with that part of it. To them, it's only when you have issue that you go there. And of course, when you have issues, but the truth is that nobody is immune. We can have issue at any point in time. There's no immunity, there's no vaccine to say, okay, take this vaccine, you will never have mental illness. No. But of course, what we want to preach is the preventive measures, the ability to seek for help. Things like what Nous is doing, creating the awareness, bringing it down to the community, because the truth is that when people leave their communities and go to the hospital, what happens? They come back to the community. So that help is highly needed in that community to help them. Another major issue culturally we have is that we have a big gap, mental health gap, which of course the WHO is looking at now. The primary healthcare system do not accept, do not welcome mental health related issues. Once somebody is ill, rather than that person going to the community health clinic, they are going straight to the tertiary institution. Yaba, for example, is a tertiary institution. They are going straight over there. And once the person is now being managed, going back, there's no, so the burden of care is very high. Out of the pocket payment is there. There's NHIS, HMO, people rip people off. So you hardly see that acceptance that, oh, this is mental health. They never get well, they are violent, people lock them up. In Togo, we have only 4 psychiatrists in the whole country. Wow. In Togo, yes. Only. So that there are some pictures here I don't have. Yeah. Like the mental, this is one of the, this was a live patient, chained, and by the time they brought him, the key was missing. They had to look for something to cut it off. Because what happens in the pathway to recovery or the pathway to seeking for help, people do not come to the psychiatrist. They are the last point when they've asked to buy purple goat and green ram and yellow horses, you know, because those are the things they ask them to do. They chain them onto one place, flog them, give them water, rain, sun. Those are the things we want to change. Yes. This is one good thing that Nous is doing. That's why fascists in the UK, we feel her back home. Because when they now ask, okay, so Kadri, you know you are doing a lot of mental health. Who are the people you be? I say, yeah, these are the people that are doing this on mental health. People say, and I found one organization in UK, I say, oh, I already know her. So things like that, these are the things we want. There's those ideas that giving mental health a face. Amen. Yeah. Giving that thing that is not just about physical illnesses. Mental does not have a bandage. There's no x-ray to say this person has mental. They are the behavioral manifestation that people will exhibit that you may think, oh, this person has. But quite a lot of time, like the lady that jumped, she didn't exhibit anything. She was just there, and then she said she was going for a walk, and she jumped. We have cases like that these days. So now we are not talking about people just being locked up, or people now jump Third Mainland Bridge. People now hang themselves. People now, hit one of the, because the stress is getting too much, and all this borders down to whether you are physically ill. A long-stay pain patient in the hospital can be suicidal because it has lingered on for a longer time than he or she expected. So culturally the good things are there, but on the flip side, there are so many wrongs that we need to rewrite. There are so many things we need to rewrite. And one major fact we need culturally right now is a mental health act. We do not have one. Nobody wants to sponsor it. The last person who is sponsoring it has issues with the American state government. So the next thing they will take in, that bill will be taken out. So in Nigeria, these are the things you hear. Everybody, how are you doing like this? I'm fine. It is well. But this is how we've been able to interpret it is fine and I am well. Because are you really fine? Is it really well? Somebody is obviously and is telling you I'm strong, but I won't be able to come to work. You know, the way we interpret things culturally, you know? And then somebody doesn't have money, you say, like I'm very rich, please, can you just give me £5 to go to... You know, the way we interpret it gives a different picture to people. Because it's our culture, we understand and we accept it. And that's why people like him, when they come to a place in Nigeria, there may be a little bit difficulties, but I was very happy with the statement he made, that it treats people culturally. And that is the best way to manage people, because in psychotherapy, you can be apostolic, listen more, talk less, make them more participant, don't criticize and all that. But though we have deficit, though we have issues in Nigeria regarding management, assessing, getting to the right places, meeting the right set of people, and the right time for management of mental health. But with the help of Nous and so many other organizations that are helping to bring awareness, we are hoping that we'll get there very soon. Thank you.
Okay, we're running just behind time a little bit, but it was all working. Wouldn't you agree?
Yes.
Just before we break for lunch, I'd like to actually say that we have membership form. We're trying to get as many people involved as possible. So please, I would advise you, complete a form and join us. It is a very, very worthwhile organisation. I'm sure you'll agree to.
I'll just talk a little bit about the membership form. This kind of forum is something we'd like to do as often as possible. We want to break the barrier. And of course, it takes money. It takes having people on board, people buying into the idea, going into the community, having resource. And what we'd like to do is we want people who will become members of the Nous. We actually have some Nous ambassadors. You see some young people. We have a session later after lunch, and you're going to see some young people who will be talking. They're very passionate about their generation and the impact of this on their generation. So we're going to be giving out, so that's the membership form. So if you'd like to be a Nous ambassador, we call ourselves Nous ambassadors. So we're all out there going into the community, changing the language that is used outside, changing the impression people have about mental health outside. We don't want to hear the use of the word psycho. I don't think it's right for you to see someone committed suicide, because suicide is no longer a crime in England. It's actually when somebody takes their life, you actually say somebody died by suicide. So when you see somebody committed suicide, you say they committed a crime. It's not a crime to take your life any longer in UK. But however, we'd like you to buy into the Nous. We want to go out there into the community and preach the good news. The fact that, listen, there's nothing wrong with being mentally ill. Just like there's nothing wrong with having cancer. Of course, it's a wrong state, but the fact, what we mean by saying nothing is wrong is the fact that it's not a different illness like having a broken leg. It can be treated. Mental illness is treatable. And there are quite a lot of people who are in the house today, who are here, who are survivors. We've been through and we're out. And we're out to say, listen, when you're down, you can still talk. Don't keep quiet. The longer we keep quiet about the state, the farther you are away from treatment and the farther you are away from recovery. So please, would like you to join us. We have 3 levels of membership. There's a project board, and you see a lot of us with the shirts. Thank you very much. Those are my team. Those are our guys. They're Nous ambassadors. And then we have the advisory board level. So if you, that's where we have our psychiatrists, the psychotherapists, those who advise us on these are the areas to go, that's the area to go. And of course we have the champions as well. So please take the form. I'm sure somebody, if you need a copy of the form, you can put your hand up. Somebody will give you a copy of the form. Thank you very much.
Okay, we shall break for lunch, and please, we'd like to start by 10:02. So we've got 15 minutes.
Lunch is in room 3, so we just file out very, very silent quickly, and then we can come back. And we're back in how many minutes? 15 minutes. And the loos are there, they're all well signposted. So lunch, drink, inform. And when I use the word disinform is to take away completely from our minds the previous notion that we have about what mental illness is. One of it is the fact that when people say somebody has mental health, there's this wrong notion that mental health is mental illness. So people say, oh, you see that person has mental health, even among professionals. And sometimes when I hear professionals use such words, I just get a big sigh like, we all have mental health. Everybody has physical health. So for you to now use the word mental health to describe somebody who is going through mental illness is not right. For you to say someone has committed suicide is not right. It's someone has died by suicide, because suicide is actually the act of one person taking their lives deliberately. I'm going to hand you over. I actually had to say that quickly as an intervention, as a filler. I'm handing you back to the MC for the day. Thank you.
We're all fed, watered, ready to go?
Yeah. Yes.
Pardon?
Yeah.
No, who said no?
Nous.
Okay. We had a speaker that was due to be speaking now, but unfortunately he hasn't arrived yet, so we're just going to go straight to the open mic session. However, before we do that, I'd like to introduce our speakers to come and take their seat, and you can ask them whichever question you feel like asking. First of all, can we have Councillor Butt, please? As you all know, leader for Brent. And could we have Dr. Shade? And can we have Ian? And the Dr. Stroke comedian. So, based on what you've heard today, if you have any pressing questions to any member of our panel, please feel free to do so. Pastor Femi would like to ask a question.
I'd like to say that it's been, can I sit down? Last time, first time I've been in Nous atmosphere, but this has been particularly educative. One of the earliest principles I learned in life is that prevention is better than cure. In terms of the situation with mental health, whether in Nigeria, which I'm very familiar with, or in India, which I have an idea about, or in Britain, how best is it to ensure that these things are prevented rather than do battles, you know, either spiritual battles or, you know, whatever kind of battles, you know. Prevention, I was told as a child that is always better than cure.
May I get the ball rolling? And I'm sure for mental disorder is different from mental health. As Lade quite rightly said, we all have mental health. We either have good mental health or good mental functioning or not so good mental functioning. So that's the first point. In the same way that somebody will have, you know, really good physical health or not so good. Now, I think it's important to say that, you know, mental illness is a very wide umbrella, and I don't know so whether you were present when I started my talk by saying that, you know, if I have a cold, that's physical illness, but it's normally quite minor, unless my, you know, immune system is very compromised. But in the same range, in terms of respiratory function, pneumonia, which is also a respiratory illness, could kill somebody, especially if you're very young or very old or immunocompromised. So I think my starting point is that, you know, in terms of mental illness, I don't think that one can completely prevent mental illness. However, there will be factors that can promote good mental health, and there will be other factors that can impact and cause a deterioration in mental health in the same way that there are factors that promote good physical health. I think it was Ian and Dr. Kadiri that talked about culture and about understanding. Isolation, I'm just going to name something that I think can promote good mental health. So I think having very healthy relationships promotes good mental health. Living a life where you're able to have very good coping strategies promotes good mental health. What do I mean by that? Problems come to all of us, but some of us are better endowed at coping and dealing with problems than other people. You have to remember that certain mental illnesses have a genetic predisposition, so there might be nothing you could do to actually prevent that mental illness. I think that, you know, just in terms of preventing or managing, it's good to get help earlier, sooner than later. Just like any issue in life, things become more complex if they're just left. Having an understanding of symptoms so that you can recognize them and look after your own mental health. For example, having a good sleep, work-life balance, eating properly, sleeping properly, engaging in recreation are all positives. There is research to show that having a faith predisposes to good mental health. So I've just drawn on a number of things that can promote good mental health. But I think it's important to say that, as I said at the beginning, that in terms of mental illness is multifactorial. You know, there's no one cause or one shoe fits all. So they're just strategies that you can use, but you may not necessarily prevent it, even if you do everything right.
All right, then we're just going to start the open mic sessions, and we just want this to be as interactive as possible. We want to hear your opinions. We want to hear your views, and if you've got any questions, the speakers are here to answer them. And if you've got any views that you want to share with people as well, please do feel free to do so. I'm just going to introduce, Tumi's going to introduce himself first.
Yeah. Hi guys, my name is Tumi. I'm 24. I recently just graduated from my medical science degree. But before I started university, I was diagnosed with bipolar. At the age of 4, I was diagnosed with dyspepsia, and it's a common knowledge that mental health is quite common. Where mental health issues are quite common in the people that have dyspepsia. And when I was 16, I had like an episode. Really, I was having bipolar. So there was times when I would just be really depressed, or other times when I would just be really excited. And I had to be taken out of school and everything. And it was a time where I was on the back of I had suicidal thoughts. And what I wanted to say is that I've been there before, but luckily for me, my mom was a pharmacist. So when my mom was talking to one of my aunties who was a GP, she was like, your son needs help. My mom knew what to do, and what she did was, because she had worked in mental health before as a pharmacist, she knew exactly what drugs I should take and everything like that. And to the glory of God, I'm here today. I'm really interested in the fact that mental health, it's common knowledge now that students are now more likely to have depression issues and suicidal thoughts. Also, middle-aged men are also more likely to have these issues as well. So personally, I'm quite interested in that today. So yeah, that's me. And I'm going to pass it over back to Jewel.
Hi, my name is Jewel Amisu. I'm 23 years old. I'm a clinical practice lead at East London Foundation Trust. I've worked, during my nursing training, I've worked all over the place. I've seen people who have suffered from suicidal ideation and also with depression. I've worked amongst people from young, old, women, men. So I'm just interested to find out how everyone feels that as a mental health practitioner, how I could help them, or how, I know there's other mental health practitioners in the building as well, how you feel that we could help them, or what actions would make a difference in their road to recovery. So that's why I'm interested in finding out today.
So today, like, this isn't, I do not